Hello. In this case study, the therapist examines the following hypothesis. The effectiveness of using muscle energy techniques in assistance with the massage therapy to regain mandible range of motion in a client with temporomandibular joint dysfunction. The reason this hypothesis was chosen is because the problem with TMJD is quite common with the current practice of the therapist. Typically, in modern days, people spend much time sitting, working at the computer, texting, etc. This leads to a head forward posture and puts more pressure on mandibular joint. Work stress, chewing habits, whiplash, um, malocclusion of teeth, missing teeth, previous injuries to the head. These are some contributing factors to jaw dysfunction of many clients who seek out solution with the therapist. This hypothesis was chosen in order to be able to incorporate the techniques that work best in a shorter period of time into the therapist's future practice. The client has provided with the consent to be treated for temporomandibular joint dysfunction treatment. His health history was recorded and the following has been observed. The 36-year-old person has been having chronic jaw issues since the university time after doing grappling, studying and going through stress at a high stress job. Client has a recent history of injury to the ear, also sports related, followed by surgery, and has had trauma in the maxilla, after which some teeth fell out gradually. He has been provided with the massage therapy treatments in the past. However, the issue comes back chronically and the client is experiencing crepitus, popping sounds, wakes up in the morning with a sore jaw and the mandibular range of motion is being reduced gradually. This indicates of the limitation with the therapist's current practice as a massage therapist. We have measured the typical S-type curve depression dysfunction accompanied by the clicking sound on the left articular disc joint area. Client has also been measured for the starting range of motion in the jaw, depression, and lateral deviation. So the following numbers are presented. With the depression, he was 3.1 centimeter into depression, right deviation 1.1 centimeter, left deviation 1.4. Protraction and retraction were within the normal painless range of motion. Also, when the client was performing Mitchell's 10-step screening test, the head forward posture was observed in a seated position, indicating that the mandibular joint is being pressured to retract and elevate, if that is our client's habit of sitting. The beneficence and non-maleficence principle has been satisfied as the client is a good friend and is helping a therapist with his case study. Also, all of the risks and benefits of the osteopathy treatment has been explained to the client, and there is no potential harm to client's health as we went through the treatment plan together. The subject knows what to expect in the treatment session. Biological determinants. There are several lesions associated with our client that play a contributing role to the current healing process, some of which include a psychological lesion, that is, stressors from 50 hours of mental response while in physically demanding job, hereditary, wide jaw, which makes a glide over the articular cartilage visible and profound, and lastly, physiological lesions, that is, the ear surgery in the past, maxillar injury and surgery, uh, some fallen teeth associated with sport injuries, which were due to prolonged wrestling and sparring. All of these physical traumas that happen in the years of youth are hindering the recovery process and the rehabilitation. Things that may improve our client's healing is more time spent taking hours from work as well as consistent attendance of the health centers who can focus on physical rehabilitation, osteopathy manual therapy, orthodontistry, and even psychological or spiritual rehabilitation for stress management. Our study was based on the osteopathy treatment with the focus on muscle energy techniques which would restore the mobility of the S-type curve and increase the range of motion, followed by the massage treatment with the standard Swedish ischemic compression technique done on temporalis, masseter, medial and lateral pterygoid muscle, as well as sternocleidomastoid muscle. The time frame: 10 minutes for muscle energy technique and 25 minutes for the massage therapy technique. Assessment and reassessment are used as tools to measure the results of the study. The ruler is used to get a precise reading of the improvement of the depression. This ruler is really effective in our case because we can get a very good reading that we can record. Vinyl gloves are used for the intraoral osteopathy manual manipulation as well as massage. The client has confirmed that he is not allergic to vinyl gloves. And the following are the results of the study. The results have shown improvement in the range of motion after the muscle energy technique in depression towards 4 centimeters. The lateral right was improved to 1.4, the lateral left to 1.6 centimeter. The next part was the massage recorded, the massage treatment, and the range of motion has improved and been recorded. In the depression, it went further down to 5 centimeters. The lateral deviation to the right, 1.7 centimeters. To the left, same, 1.7 centimeters. Now regarding his personal treatment plan. Client has approved the treatment plan proposed by a therapist, satisfying the partnership principle of the manual osteopathy. As for our immediate goals, we have determined to spend 4 sessions, of which the first one is meant to properly assess all of the 3 unities: Unity 1, Unity 2, Unity 3, the GOT test, the muscle strength and flexibility test. At the second session, we will address the Unity 1 correction and Unity 2. Specifically, we will focus on the pelvis, hip joint, coccyx alignment. Following that is Unity 2. We will spend time addressing neck tension, reduced cervical range of motion, high right ear, elevated left shoulder, cervical C1 to C7 alignment, finishing up with mandible assessment, treatment, and reassessment. We are using muscle energy techniques following up with the massage of the muscles of mastication. The third treatment, we will reassess again the unities and posture with screening tests and address the Unity 3 if the need be for specific adjusting techniques. If not, then the therapist will once again assess the correct cervical spine, followed by muscle energy technique for mandible joint in case the range of motion has decreased or there is a recurring pain symptoms. The fourth session is an overall assessment and a correction where needed. All in all, we have come up with the plan to work towards client's proper alignment and even discuss the possibility of attending other referred places to better integrate the holistic approach. This decision is based on the partnership principle again. The appointments would be held once a week for the period of 4 weeks, 1 hour per session, with the first 15 minutes taken for assessment. And the client is asked not to pay the fees as they are the subject for the educational case study. The cost-benefit analysis shows that it's a win situation for the client, as he has already determined to do something about his health. In addition to that, his work was flexible to allow him to spend more time off towards restoring his health back to normal. As for the therapist, it's a bit of a loss, but it's a win in a different sense. This benefits him in a sense of gaining experience and practical utilization of a new approach in dealing with temporomandibular joint patients holistically. The result of the case study clearly indicates that there is a considerable improvement in the client's mandible joint, specifically in the lessening of tension and in the restoration of the range of motion, which proves our hypothesis. The goal was to see if osteopathy approach can be used effectively in dealing with temporomandibular joint TMJD patients. When we separate the study into two parts, the initial part was the muscle energy method and the massage therapy. We can see how they both complement each other in restoring the range of motion, because each one added an extra centimeter towards the depression of the mandible and an extra 3 millimeters towards a bilateral deviation. Here I can demonstrate how the initial phase was 3 centimeter 1 millimeter. After MET, it increased to 4 centimeters. After massage, all the way to 5. Same with the right and left deviation. With the right deviation, it went from 1.1 to 1.4, then 1 to 1.7, and here as well from 1.4 to 1.6, and then after massage, it's 1 to 1.7. And these three numbers are the last reading. Using the 3-knuckle test, it is evident that the full range of motion of the jaw was achieved. So 3-knuckle test is basically taking everyone's fingers are different, everyone's jaw is different, so it's up to one's own jaw. If you can fit in 3 knuckles in your mouth, then you have like a normal jaw deviation, jaw depression. And our client couldn't fit the 3 fingers at the beginning, so that would be like the rule of thumb in measuring it. In the end, it was surprising for both of us to see the immediate improvement after 1 hour osteopathy treatment. The therapist does acknowledge that there are limitations in the techniques used for temporomandibular joint dysfunction approach. For instance, fascia and temporal bone, articular disc, and mastication muscles could have been addressed more. Also, client did not rid of clicking sound from the depression of the jaw. Thus, we can assume that other factors should be addressed more thoroughly, such as stress-related muscle hypertrophy, client's proprioceptively disordered muscle memory in elevation and depression, lack of myofascial release in temporomandibular joint cartilage, teeth occlusion problems, lack of teeth, or the chronic tension headaches which the client also presented with. Our short-term goal for our client is to maintain the balance in the pelvis, spine, neck by working on the proper posture exercises in order to correct the head-forward posture and regain proprioception of one's position in space. The long-term goal is to address the overall well-being, addressing his other lesions listed above by possibly referring him to other specialists and seeking a more balanced quality of life. Client could improve a lot by attending monthly or bi-monthly massage in combination with the manual osteopathy sessions, by checking with the dentist or orthodontist and getting prescription for the possible malocclusion problem. Also, by seeking correct exercises from the physiotherapist to establish an improved muscle balance. There are some limitations to the research, as the study was narrowly focusing primarily on the effectiveness of the osteopathy technique in regaining the proper range of motion. However, we weren't addressing the holistic approach to the health of the body, though after a thorough assessment, the client is well aware that more treatments are needed to bring balance throughout all the unities and throughout the whole body. Looking at the tensegrity principle, the changes that are being produced, though very locally, will affect the rest of the body. Having said that, there are many health benefits of combining osteopathy techniques with the massage therapy techniques in one session time as evidence in the obtained results. The two have value and right place within the holistic approach of the osteopathic modality. For the further studies, the therapist would most likely choose a greater sample size of participants with similar lesions to examine each one over the period of 1 year to be able to see if the improvements of the corrections are temporary or longer lasting. The role of osteopathy is crucial in the recovery process of the patient. However, it is within the scope of the practice of the manual practitioner to seek an integral approach towards the healing, and therefore other healthcare practitioners play a very important part according to the holistic philosophy of manual osteopathy. With the lesions that are present in our client, it is necessary therefore to collaborate with other practitioners such as medical doctor, dentist, physiotherapist to achieve the desired result. Conclusion. In this case study, the therapist has gained significant clinical knowledge of assessment, palpation, observation, and treatment skills. We have put to the test the osteopathy techniques that are used to treat mandible alignment. The lesson is clear regarding the effectiveness of muscle energy techniques in collaboration with the massage therapy technique in order to regain the full range of motion of the mandible. The experience that has been gained here translates into the further tool set of knowledge, allowing the therapist to use it freely for utilization in our future clinical practice when treating patients with temporomandibular joint dysfunctions. Thank you for your attention.